lot of the pharmaceutical companies, a lot of the food industry. Like, why is any organization that is creating medical guidelines taking funding from drug companies and from food organizations?
What is the wrong advice that you think physicians have been giving on metabolic health?
Healthy whole grains, high carbs, low fat. That is what is being promoted, which is exactly the opposite of what we need.
There's so many questions about how to cure kids with autism.
We've seen in studies and in real world practice that people can completely change the way their brains are functioning when they're running on ketones.
Today, everything seems to be politicized, including medicine.
It should not be a political issue, though. So anything that defines it as blue or red issue, that's where it could potentially hurt. This is about people, not politics.
Dr. Bret Scher, it's good to have you here.
Thank you, Marissa. It's my pleasure.
So as you walked in, I said that it's a very interesting timing for you to come in because we're in the middle of medical questions and chaos.
Yeah.
And we don't know if to trust the experts. We don't know who to rely on. And your answer is, well, there's always medical questioning and chaos. So maybe that's a good thing.
Maybe it is, right? I mean, I think asking questions is healthy. The problem is sometimes when people want the status quo to continue and then you ask questions, it gets really uncomfortable. But I mean, when did asking questions become a bad thing? I think we should promote more of that.
Yeah. I think the status quo in general is easier, right? It's easier to just keep doing what we've been told. It's easier to not have to wreck our brain over how to become healthier. It's certainly an easier thing to do. And I think humans generally want what is easier, not necessarily what they have to work hard for.
Yeah, but then there's the old question, how's that working for you? And I think we can say in the experiment that we've seen in our population over the past 40 years, it's not working so well from a health standpoint.
Yeah, sadly, it's not working.
Yeah.
So I'd like to let's get a little bit into your background. You started as a cardiologist, right? What drew you into that field?
Oh, gosh, going back to my medical school days and my residency days. But, cardiology for me was just always such a magical field because you really sort of span all aspects of medicine, right? There's the sort of the emergency room type feeling of there's a heart attack happening, all hands on deck, do whatever you can. There's a little bit of the surgery aspect that you're using your hands and you're doing really kind of interesting things to help people. And then there's kind of the primary care aspect where you're helping people with their blood pressure and their cholesterol and their long-term risk, and you're seeing them over time. So it sort of spanned all those aspects of medicine, which I thought was so interesting, where you could really help people and have an impact on people's lives. And, as we get into real life of medicine, so to speak, you realize that your perception may or may not be correct, and frequently not. But that was certainly what got me excited in the beginning, and I was all about it. I loved it.
So you went from being the Dr. Heart guy to the Dr. Heart and Gut guy. Is that a fair statement? How did you go there?
Well, I guess I went from being the traditional cardiologist to being the metabolic cardiologist is how I would phrase it. And really this transition towards metabolic health. Because I think it was a discussion we just weren't having enough of. And part of the reason why is because it's harder to help someone improve their metabolic health through lifestyle than it is to give them a pill for their cholesterol. No question about it, right? A pill for your cholesterol is a lot easier. So that's where a lot of the research was focused. I love those cartoons. I feel like I quote this cartoon all the time of the person looking for their keys under the lamppost. And they say, oh, is this where you lost your keys? And they say, no, I lost them down the street, but this is where the light is. So I'm looking here. And we tend to do that in medicine a lot. We tend to look where the light is. And so the light quickly came to cholesterol, medications. And so that's where the focus was. And it's not that it was wrong or completely off base or had nothing to do with health, but I think it came at the expense of maybe some of the more important factors, including metabolic health. So that was part of what led me to focus more on cardiometabolic health. And that led me to low-carb nutrition and ketogenic interventions. I was very lucky when I started this wellness center with a friend of mine. I knew nothing about low-carb and keto because I was not taught anything about it. And it was through him that I started to learn about it. And then I started to look and realize there was research on it. And why haven't I heard about this? And I guess that's why I felt like I had to shout it from the rooftops, because nobody was talking about it. And it was something that could really, really help people who are struggling with their weight, with their type 2 diabetes, with their blood sugar, with their metabolic health. And that only improves people's lives. And not that everybody needs to go that route, but gosh, so many people could benefit from it. So that was a very long answer to your question of how I started as a cardiologist. And I still practice cardiology. But I focus on preventive cardiology and really focusing on metabolic cardiology.
When this doctor, friend of yours, started talking to you about food and metabolic health, what was your first reaction? Because oftentimes when I talk to doctors about nutrition, they'll say, yeah, that's great and everything, but here's a pill that's most likely going to work better.
Yeah.
So was your reaction similar to most doctors?
Well, my reaction was I really wanted nutrition to work and have an impact. But unfortunately, we sort of learn by experience that what we're teaching people and how we're talking to people about nutrition doesn't work. Like how many times do you sit down and have a well-meaning conversation with a patient and say you need to eat less and exercise more and really focus on your healthy whole grains and your high carbohydrates and lower your fats, and then come back 6 months later and nothing's changed. So you write in your chart, lifestyle interventions did not work. And then what's next is a pill. Happened all the time. There's an old saying, if you're a teacher and one of your students is failing, okay, maybe it's on them. But if you're a teacher and half your class is failing, it's on you as the teacher. So as a medical profession, if people aren't following the medical advice, if people aren't doing what we're telling them to do from a nutrition standpoint, and not just one, not just two, but the majority of the population, maybe it's on us. Maybe it's the wrong advice. And I think that's sort of the insight that the medical profession has just lacked. It really has been a doubling down of the same nutrition advice, only stronger, only even less fat, even more healthy high carbs. And that's come a point where we have to say, no, it's clearly that's just the wrong advice for the majority of the population. And we need to be more introspective about that and change it.
What is the wrong advice that you think physicians have been giving on metabolic health? Is it that we should be eating more oatmeal for heart healthy?
Yeah, that's part of it. So the first wrong advice is that we don't even really know how we're defining metabolic health, which is part of the problem. Because I think, so what is metabolism, right? What is metabolic health? It's how our body takes in nutrients and transforms it into energy, right? Very simple. But it's not so simple, right? Because we're taking in nutrients and we want to use those nutrients, being the carbs, the fats, the proteins. We want to use those for energy. We don't want to end up storing them, all right? And part of the problem is when you give advice that doesn't work or people don't enjoy, right? We're talking about food. We're not talking about something like reading a book, I don't know, or we're talking about food. There's emotion involved. We are very emotional people. We get hungry. We have cravings. We eat emotionally.
There's culture around food,
There's
too.
culture around food. Absolutely. So to think that we can be, I actually call it arrogant, that we can be arrogant enough that we know the one way everybody's supposed to eat. It boggles my mind. And I think we clearly have the experiment that it has not worked. So reducing saturated fat, reducing animal products, healthy whole grains, they give this air of good and bad for food, and ignores what the food does to how it makes people feel. How hungry are you? What does it do for actually giving you nutrients? And, animal products are some of the most nutrient-dense foods there are. So to have a policy that really wants to restrict those is restricting one of the most nutrient-dense foods that has the highest amount of bioavailable protein and really fills you up and people enjoy. And these are concepts that we can't ignore. And I think that's what our health crisis is telling us, that we can't ignore those.
Well, you're a heart doctor, a cardiologist. It is usually the heart doctors that would tell us to not eat meat and not eat eggs and not drink milk because of cholesterol. So what is your reaction to that?
Yeah. My reaction is we focus on very low quality evidence to make very confident recommendations. Right. So a lot of the evidence we have in nutrition come from these large population studies where all you do is observe what's happening and there's no actual intervention. So a lot of people say, well, yeah, that's the same study that we found for, smoking and cancer. Well, yeah, for the connection between smoking and cancer, there is what's called a hazard ratio of like 15 to 20. And that's, you can say, how strong is the effect of the one thing on the other, right? On tobacco and on cancer. Well, when it comes to things like red meat, saturated fat, and heart disease or cancer, it's like 1.3, 1.4, not 15 to 20 like it was with smoking, but 1.3, 1.4. So the quality, the level, and there's so many other problems with those studies, but the level of the evidence is so low for us to then say, well, this is clear, we have to eat in this way. It really elevates the evidence to try and make it represent something that it's not meant to. And it ignores the fact that we don't eat just saturated fat. We don't eat just meat. We eat a diet, right? So are you eating your burger with the bun and the ketchup and the fries and the Coke, right? The classic. Or are you eating a ribeye steak with some broccoli and cauliflower and avocado? Your body is going to handle those meals completely differently. But certainly the studies don't differentiate between those, and our recommendations don't differentiate between those. So I think we need to get away from talking about specific foods or even specific nutrients, and instead talk about what is the diet that you're eating? What are the combination of foods that you're eating, and how does that impact your metabolic health as we define it by your fasting insulin level, your HDL and triglyceride blood levels, your visceral fat, your body composition, and not just whether or not you have type 2 diabetes, which for decades was sort of how we defined metabolic health. So it really is sort of a reframing of things. But I think the main thing is realizing that the way we eat is more complicated than we want to make it. Saturated fat's bad, red meat's bad, grains are good. Not really. If you already have type 2 diabetes or metabolic dysfunction, which unfortunately is a growing percentage of our population, there's some estimates that 93% of our population have some element of metabolic dysfunction. 93%. I mean, it's fascinating. It's kind of mind-boggling. And over 70% meet criteria for overweight or obesity. I mean, the numbers are just staggering. So it's clear what we're doing is not working, but it's also clear that we can't make one recommendation for everybody, because that population that has metabolic dysfunction is going to tolerate the so-called healthy whole grains and the healthy carbohydrates much different than somebody who is metabolically healthy and active and has a completely different metabolism. We can't pretend that there's one diet for both people.
Why do you think there's such a chasm between mainstream medicine and, I guess you would call it, holistic medicine, holistic with a WH?
With the WH, yeah. Well, one, it's a very charged word, right? A lot of people will interpret that differently. Some people will interpret that word as, it's amazing. You're looking at the whole person and you're trying to take an approach that is more broad. And other people are say like, oh, you're just trying to do what modern medicine isn't doing, and it's a bunch of quote unquote quacks, right? You can interpret that one word so differently. It's a very polarizing word. But at its core, if you're talking about looking at the whole person and you're talking about taking a broad approach and not focusing just on one aspect, it makes total sense. That's the way we should be practicing. I mean, people are people. We're not a lab value. We're not a diagnosis, right? We're people, and how one thing we do impacts something else completely, right? I mean, we've learned, it's a very charged topic, but statins for treating cholesterol. I'm a cardiologist. I am a believer of using statins to treat cholesterol in the right patient. For people with heart disease, for people who are at very high risk of heart disease, it has a role. But we also are learning that can increase somebody's risk of type 2 diabetes and metabolic dysfunction, right? So it's not just treating the LDL. We want to treat the LDL, but we really want to treat the cardiac risk. So if one treatment is worsening another aspect of cardiac risk, we have to consider that. To me, that's what holistic means, right? So, but the word is so charged, I almost never use that word because I know people might misinterpret it.
Do you think that gap is becoming smaller, the gap between holistic practitioners and traditional doctors?
Yeah, I think it's becoming smaller because more people are talking about it, right? And now on social media and, this concept of root cause medicine and concept of functional medicine, we're hearing so much more about it that I think the gap is starting to close, and we're starting to see some research, and we're seeing, just endless amounts of patient success stories, but nothing's perfect, right? It's still not clearly defined what it is or how you practice it, right? So there are still some questions, but I think what you're saying is the gap, I think, absolutely is closing because we're just hearing about it so much more, and patients are demanding it. I don't want a Band-Aid for my problem. I want to know what's causing the problem so I can get rid of it.
Do you think it's doable to expect doctors and physicians, especially with a country with over 300 million individuals, to be able to create a medical formula for each patient? I mean, it sounds honestly somewhat confusing, right? Because sometimes some patients should eat keto, some patients should not eat keto, some patients should take statins, some patients shouldn't take statins. I think one of the reasons why conventional medicine, as we know it, has worked is because the physicians could go through medical school. They could be given a formula for how to treat a patient. They can be given a chart, and they can be given a computer where they could look things up and basically align a certain symptom with a certain medication and basically merge them. And it's why from an operational perspective, it must have been a lot easier to manage, especially when you're talking about millions and millions of patients. In the case of functional medicine or holistic medicine, when you have to create a special roadmap for every single individual that you're treating, it becomes very complicated. It also becomes complicated for the patient to advocate for themselves because we don't know what to ask for. I don't know how to go to you as a cardiologist and say, well, here's what I'd like you to help me with, because the roads are becoming very confusing.
Yeah. I mean, you bring up a great point. And a lot of it comes down to how is our medical practice structured? And gosh, I feel for the doctors who are in the system, right? And they have 15 minutes with a patient if they're lucky. And then they have tons of charting to do after that. And you're exactly right. You know, how are you going to have that individual conversation and come up with that individual plan in that type of structure? Whereas people who practice outside the system, which fortunately now my practice is outside the system, I can spend an hour with my patient, right? I can give them that individual advice. And I'm not running from patient to patient like that. And so it is hard when you're in that system, no question. And it's much easier to say, here are the guidelines. Here's how you're supposed to practice. A, B, and C is what the patient has. Guidelines say treat it A, B, and C. But let me ask you, do you want to be treated that way? I mean, do you want to be treated like a number and just a guideline? I would guess not. I certainly don't. So it's a perplexing question. How do we transform medicine from where we are to get more individualized? And you know, a lot of the answers has to be, it doesn't all fall on the physicians, right? They need logistical support. They need, whether it's coaches or dietitians or, you know, PAs, nurse practitioners, to help with more of sort of the one-on-one individual structure of a plan. And then the physicians oversee it, right? You could see how there are you could put different things in place to try and move that direction. But seems like a long way between here and there, but that's why I'm thankful I can practice the way I practice. And so many physicians are able to break out of that system to really help people.
So many patients that I'm aware of are starting to look at their own blood results. I mean, there are all kinds of programs that you can download an app and take a look at the results and possibly make decisions where you're not going to prescribe yourself things, but you can prescribe yourself food, which food is medicine too, right? And so you're seeing more of that where people are saying, well, it looks like based on my blood type, or it looks like based on my markers that are coming in through my blood results, I should possibly change my diet and eat different things. What are your thoughts on the individual trying to take that kind of responsibility on?
You know what, Marissa? I love it. I think it's fantastic.
You're okay with us working you out of business?
That's not a bad thing. That's not a bad thing. As long as you're focusing on the right parameters of metabolic health, which is what I'm so passionate about, is metabolic health, which I think medicine in general kind of avoids. And that gets back to this sort of dietary recommendation that we started talking about. Do I care that you eat a specific diet? Or do I care that you're getting the health results that you want and that I want for you? That's what I care about. So the diet that you use to get there may not be the diet that everybody thinks is the quote unquote right diet, but it's your right and your ability to experiment to see what gets you there and measure the outcomes. I love that people can order their own blood test now and don't have to get it from a doctor. I love that they can interpret their own blood test. Now, of course, it can set things up for, depending on who's influencing you and depending on what kind of advice you're getting, there's certainly some risk there. But I think it really empowering people to take charge of their health and realize that they can change their nutrition, they can change their lifestyle, and they can see the outcome of their actions is just so amazing. I mean, take continuous glucose monitors, a CGM. a little monitor you just put on your, on your belly or on your tricep, which gives you a continuous reading of what your blood sugar is doing. Such amazing information. You eat the healthy oatmeal and see your blood sugar spike, or you eat the healthy oatmeal and see your blood sugar barely move. You're going to know how you respond to that healthy, quote unquote, oatmeal, right? Same thing for a steak and vegetables. Same thing for, your fruit smoothie or whatever. A lot of things that have this sort of healthy halo are not so healthy. But until we can take charge and advocate for ourselves and have the technology and the test to be able to measure it, then we're not going to know. So I'm a huge fan of people sort of taking that step.
What do you think about the keto diet?
What do I think about the keto diet? I've been promoting the keto diet for decades now. Not necessarily for everybody though. And the reason why I promote it so much is because I feel like modern medicine, contemporary medicine shuns it, and they shouldn't. And ketosis is a powerful medical treatment. I mean, it is the one diet that actually completely changes your metabolism. So in our modern world, we're burning glucose for energy, primarily, almost always burning glucose. Well, our body can also burn fat for fuel. And it's not until we reduce our carbohydrate intake enough that our body can sort of flip that switch and start burning fat for fuel, and primarily instead of glucose for fuel, and in the process create ketones. Now, this has a tremendous number of different effects, one of which is providing our brain with a different fuel of ketones. And we know people with epilepsy, people with various diagnoses of mental illness, people with cognitive decline, we've seen in studies and in real world practice that people can completely change the way their brains are functioning when they're running on ketones. So that's one amazing thing it can do. And secondly, it really improves metabolic health, because when you have insulin resistance, you have trouble utilizing that glucose for energy. You end up building up more glucose and storing it, high insulin levels. Well, ketosis can turn all that around. So I'm a huge fan of ketosis as a medical intervention for treating medical conditions. Unfortunately, it's been sort of shunned as a fad weight loss diet that is the quote unquote unhealthiest of the weight loss diets. But that just completely misunderstands what it's all about even.
Well, this is why I wanted to speak to you, a cardiologist, because usually people will say that keto can be really hard on your heart and on your kidneys.
Yeah.
Would you recommend keto for a child?
Absolutely. Yeah. So that's how it started, actually. It started in childhood epilepsy. That ketogenic diets were used in babies and in young children to treat retractable epilepsy. And now we have decades of research and clinical guidelines to support that. So we know it's safe and effective. And interestingly, one thing that does kind of get confusing is that type of keto diet is a very extreme keto diet, what's called a 4-to-1 keto diet, which means for every gram of carbohydrate and protein combined, you have 4 grams of fat. So it was a very low protein and very low carbohydrate diet. But it worked amazingly well in this population. Now we're learning, though, you get the same effects with a broader, or I guess less restrictive keto diet, which is more of what sort of the modern keto diet is, where you can have 20 to 30% of your calories from protein and 70% of your calories from fat and maybe 5% from carbs. That type of structure can still give the same benefit. So it can be safe and effective for kids. It can be safe and effective for adults. It can be safe and effective for elderly. It can, the concerns about it are often overblown.
What about the concern about a child's kidneys as they grow up eating too much meat, for example, or fats?
Yeah, there's zero evidence that it's harmful. Zero evidence that it's
harmful.
harmful.
There is zero evidence that it's harmful to eat meat every single day, even for children.
Sounds amazing, right? It's so just, contrary to everything
we've
been told.
It sounds like a Twilight Zone. That's what it sounds like. It's a medical Twilight Zone yet again.
Yeah. Yeah. So, where's the burden of proof in this discussion? Is the burden of proof that meat, a completely natural food that we've been eating all throughout evolution, is harmful? Or is the burden of proof that it's not harmful, right? I would say the assumption is that it's a natural food and we should be eating it. You have to prove to me that we shouldn't be. And the level of evidence that people try to cite for that is just insufficient. Kidney function is a perfect example. There is a belief that a ketogenic diet is harmful for the kidneys. Well, there have been 2 or 3 recent publications, one of a physician's practice, Dr. David Unwin, his clinical experience, and one from Virta Health and Dr. Thomas Weems, which shows exactly the opposite, that people following ketogenic diets improved their kidney function. But yet there's this belief that it hurts kidney function. So how does one exist? And a big part of it is just a bias. It's just an anti-keto bias because we're taught plant-based, we're taught low-fat, and we're taught low animal products, right? So anything that goes against that, we're going to have a bias against. And I get that, right? I get that. If you truly believe what you've been taught and you don't take a step back and you say, well, wait, how is this different? And what is the research really showing? And so, yeah, it's a big part of my job of what I do at Metabolic Mind and Coalition for Metabolic Health is combating these beliefs, which simply aren't based in reality.
You mentioned keto diet and mental health, bipolar, depression, all of these things that we're seeing our children grow up with.
Yeah.
Do you think that children should be put on a keto diet with the possibility that it would help them work their ways out of being medicated?
That's a good question. And that's a harder question to answer than if somebody already has a diagnosis of depression, bipolar disorder, certainly treatment-resistant depression, schizophrenia, and they're trying the medications and they're just not getting the treatment that they want. They're not getting the results that they want. In those cases, I'm a huge proponent of a ketogenic diet. And that's a big part of what we do at Metabolic Mind is try and share resources and share education, both for the clinicians and the individual, about how ketogenic diets can work. And Mizuki Group funds research to help promote or to help investigate this. And so what we're seeing from pilot trials is this is incredibly effective.
Like what have you seen that's been effective? Have you seen children possibly get off of antidepressants after changing their diet, maybe being also activated, having meaningful experiences throughout the day? Like, what are the chances? I've become very, very focused on trying to get kids off meds.
Yeah.
Because I worry and I see what it does, the numbing, the lack of focus, the inability to sometimes even build relationships for some of these young people. I think one of the reasons why we're seeing young people struggle with dating these days is because, partially they're numbed from social media and the virtual world, and partially they're numbed because of the medications that they're on, right? And so I think everything comes down to diet and lifestyle, but I don't want people to be misled. I don't want people to be misled to think that if they just change their diet and lifestyle, they could live without the potential supplements that they might need. And so how do we find a balance? How do we not mislead the public and create a common sense formula for thinking through this?
Oh boy. Yeah, it's a great question. And you bring up a fantastic point that it's not just all about food, right? There's so many other factors. How are you sleeping? How are you moving your body? How are you managing your stress? How are you using social media? All of those play into it. In addition to what are you eating? What are you drinking? What substances are you using? All of that plays into it. But when you ask specifically, should kids go on a ketogenic diet? We have a lot less evidence for mental health for children. The pediatric evidence is mostly around epilepsy. The evidence that we're gaining now regarding ketosis and mental health is mostly in adults, although there was a recent trial that came out, or a pilot trial called the KIND study, which was in college-age kids, which showed significant improvements in depression scores after 12 weeks on a ketogenic diet. And you hear people sharing their experiences and how it changed their lives. And I mean, it is remarkable. So I think we still have to stop short of saying everybody should be on a ketogenic diet and everybody's going to improve their mental health. We're certainly not quite there. But to use it as a treatment for people who are struggling with the treatment that they're already getting is, for me, a sure thing.
The second you mentioned college dorms, I just think about the dining hall and what's there.
Yeah.
And I know you wrote about it in your book, which is super interesting. And I think people with college-age children and college-age students in general should read it, because I'd imagine there's also a lot of confusion about you're on campus, you're hungry.
Yeah.
we used to be told that you need the carbs in order to focus.
Yeah.
Remember that, doctor? It was
yeah.
you need your carbs in order to focus. And you'll then go to the dining hall and it's full of carbs. It's not
Sure.
just about processed foods. And you talk about carbs, could you expect a teenager or a college-age student to grow up without eating carbs?
Well, that was part of what was so fascinating about this study that they did at Ohio State University, Dr. Jeff Volek and his team at Ohio State. And a big part of it was just that question. Can we even get college students to stay on a ketogenic diet for 12 weeks? And, what's the likelihood that's going to happen, right? And I can see skepticism from so many people remembering exactly what it was like. But they did. They absolutely did. And 16 of these individuals stayed in ketosis for the 12 weeks. And to hear their reports, it wasn't that hard.
How did they do?
No, they did fantastic. I mean, when you look at their depression scores, they reduced by 70%. 100% of those who completed the trial reduced their depression scores by an average of 70%, which is remarkable. Now, of course, small trial, motivated individuals who wanted to try this, but, why wouldn't you want to do it if you can get that kind of success? They had support, no question. They had support from the dietitians. It could be challenging for just anybody to go out and do it on their own, but this showed that it can be done and it can have an impact. And this was a group where 100% who completed improved by an average of 70%. Now, it was a motivated group. They wanted to get better. They were having support for the diet. But why wouldn't you try this if you had depression, if you were living with depression and you weren't seeing the results you wanted? Why wouldn't you try it? And there are other studies going on. We're funding a study, what's called the Child Bipolar Network, which is a network of hospitals looking at ketogenic interventions for a pediatric population for adolescents with bipolar disorder. And then there's a sort of a real life study at CMHRC, Children's Mental Health Resource Center, where they are instituting ketogenic diets on their families and really learning what it takes to support a family, to help the kid maintain ketosis and see what kind of improvements they're having. So we're learning a lot more about ketogenic interventions in the younger population and the effects on mental health. But so far, it all seems incredibly encouraging. And the research is going to keep continuing. And we just have to keep asking ourselves, why wouldn't we try this if it could potentially help someone with clinical guidance to make sure it's safe and effective?
There's so many questions about how to cure kids with autism.
Yeah.
There are questions how they got autism to begin with. But do you think keto diets could actually help kids with autism? Is there any evidence in that?
Yeah, so there's a space where there's not a lot of research evidence, but there is growing clinical evidence. So one of my favorite things that I get to do as the host of the Metabolic Mind podcast is to talk to experts, talk to all these amazing people. So recently I talked to a Dr. Tracy Gertler who was talking about her experience using ketogenic interventions for epilepsy. But a lot of the patients she works with don't just have epilepsy. They have epilepsy and they have a diagnosis of an autism spectrum disorder. And what you notice is the seizures get better, but so do so many of these characteristics that are attributed to autism. So is it the ketogenic diet, something about the way the brain is healing? So there's something there for sure. The question is, for whom and how do you do it and for how long and what are the impacts? That's what research is going to have to figure out. But gosh, it seems so encouraging from what we know at this point that it could be something.
Is it possible the improvement in the mental health of the child or these adolescents is not necessarily keto, but it's simply that they're not eating processed foods and bagged foods?
Yeah, that's a great question too. And I think when it comes to the brain, I'm fairly confident that it is keto because what we see is that the brain uses ketones incredibly efficiently. It uses the ketones for fuel, for energy. And a lot of the times, whether it's, imaging studies to see how the brain's using glucose, or we can see in a number of patients who are diagnosed with mental health disorders that they have what's called a hypometabolism of glucose. They're not using glucose very well. Well, ketones bypass that and allow the brain to efficiently produce energy or transform energy from the ketone. So I think when we're talking about the brain, the ketones really have something to do. Now, if you're just talking about losing weight, improving your metabolic health, being healthier in general, a lot of times reducing the processed foods and the refined carbohydrates and the added sugars, sure, that's going to have a pretty dramatic impact just by itself.
So it's not just what you're taking out of your diet, it's what you're putting into your diet that makes the difference.
A little bit of both, for sure. Yeah.
What about activation? What about how you spend your days? Could that be a supplement or maybe even in lieu of keto if a child is busy or doing things that they enjoy, have meaning in their lives, maybe being part of a study gives them meaning and that's taking them out of depression?
Yeah, it's a fantastic question. And like you brought up the point of social media and phones. And, if your release is just scrolling versus if your release is volunteering and helping others, right? We know we can improve our well-being so much more by helping others, right? Or if you're in active and engaged and have a purpose, no question, those are two very different scenarios that are going to impact your mental health and probably your overall health really significantly. So yeah, we spend so much time talking about food, which is crucial, but it's not all about food, right? When we look at all these societies that, live the longest and are healthiest, even though there's some debate about the how that's defined, but they tend to have a purpose, right? There's this concept of finding your purpose in life and living a purposeful life. And I think it's so powerful that that's something we should focus on and talk more about.
You wrote about the 6 building blocks for a healthy life.
Yeah.
What are some of the crucial ones that you think we should be aware of?
Yeah. I mean, one of them is finding your purpose for sure, like living a purposeful life, no question. But, you can say on the one hand, they're simple, like how you move your body, how you nourish your body, how you manage your sleep. They sound so simple, but they are so amazingly impactful when you can really prioritize them and emphasize them. So if you're talking about college kids, right? What happens to their sleep? Completely disrupted. That's going to affect their mental health. That's going to affect their physical health, right? What happens to their nutrition? Frequently that gets disrupted too. That's going to affect their mental health. That's going to affect their physical health. So really trying to focus on these pillars and not just giving them lip service, but internalizing how important they are to your life and all aspects of your life. It's crucial.
What do you think about younger kids? If you could envision what a perfect dining hall would look like, what do we need to take out of there and what should we put in? And is there a chance that it can actually be done on this large scale given how large our schools are?
There absolutely is a chance it can be done.
Something pragmatic we can actually do.
But we have to change the guidelines of what the government says is a healthy diet in order to do it. I want you to walk in and see your chicken, your steak, and your fish. And next to that, to see your broccoli and your cauliflower and your bell peppers. And next to that, see your avocado and your olives. And next to that, then you get a little bit of fruit. And you get some potatoes, and that's it, right? If that's what you get, and that's what you're eating.
Obvious. It seems so obvious,
right?
Do you think MAHA is a positive thing for the medical community? I know it's politicized, and so when the case against OxyContin came out in 2007, and it took forever until it was concluded. Maybe I don't think it was concluded until 2020. So many years.
Yeah,
I don't think it was a politicized issue. Today, everything seems to be politicized, including medicine.
Yeah.
And so now every time the FDA comes out with any sort of new recommendation or observation, it seems to be highly politicized.
Yeah.
On the one hand, maybe we're waking up as Americans because there's a larger pulpit and platform for change. On the other hand, there seems to be quite a lot of resistance because medicine has become so politicized that you have half of the country pushing against any one of the even obvious decisions, such as taking out food dyes from our diets. Is MAHA overall a good thing or a negative thing for America?
Yeah, it's a very topical question. And anything that elevates the discussion of health and how our public policy is impacting health is a good thing. Anything that gets us talking about that and focusing on that is a good thing. This should not be a political issue, though. So anything that also makes it a political issue or suddenly defines it as, blue or red issue, I think that's where it could potentially hurt. But I'm not saying that MAHA is doing that, but unfortunately, a reaction is kind of to politicize this. So we absolutely need to elevate the discussion. We need to be talking about it more. We need to make metabolic health a national priority. But this is a public issue, not a political issue. This is about people, not politics. And I think so we have to approach it that way to realize, look, this is about making people healthier. Like, how can we be against that?
I think that some of the organizations that have pushed against MAHA are the organizations that have been around for a long time and were able to get away with saying whatever it is that they said, food pyramid being upside down included, whether it's the AMA or the CDC. And it sounds like there are a lot of new organizations that are now coming together, not necessarily funded by pharma, but funded by philanthropists. Some of them you're involved in. And so are these new organizations ones that are going to receive the same credibility, given that they're new? And do they have enough funding to even withstand the old organizations? It seems like there is a fight between some of the new organizations and the older ones.
Yeah. I mean, there's definitely a battleground, I guess you could say.
It's the battleground of medicine in America.
Yeah. And, who's funding some of the older organizations, right? A lot of the pharmaceutical companies, a lot of the food industry, like, why are they taking funding? Why is any organization that is creating medical guidelines taking funding from drug companies and from food organizations? Like, that should be such an obvious thing that we do not allow. Because you can always say, oh, we're not being influenced. We need money to keep the lights on, and we're going to make medical decisions. We're not going to be influenced. But we're humans. We're influenced by money. We're influenced by, so that should be an obvious discussion.
So who is funding the new organizations? Plaintiff attorneys?
Well, you mentioned philanthropy. So this is definitely a role for philanthropy. Now, in general, philanthropy is not going to be able to compete with, multi-billion-dollar, companies and pharmaceutical companies and food industry companies. But, the Coalition for Metabolic Health, I think, is a perfect example, funded by philanthropy, with the idea being, look, what we're doing is not working. So we need to convene the experts, the scientists, the clinicians, the business leaders, the nonprofits, the advocates, to figure out what we can do differently to focus on metabolic health, make it practical, make it effective, and how do we implement it? And this wouldn't have happened without philanthropy, unfortunately, because people who are in the status quo want to continue the status quo. It's uncomfortable to break out of it. And it takes somebody sort of from the outside without those influences to come in. And that's where philanthropy is amazing. And what the Bazuki family has done with their philanthropic efforts, I hope is an example for everybody to see what we can accomplish outside of industrial influences.
Do you think the Coalition for Metabolic Health will have an impact on school lunches?
Yes, I do.
How so?
I do. I think by targeting the dietary guidelines, anything that can change the dietary guidelines to be more whole food focused, to reduce the limits on saturated fat, to understand that the quote unquote healthy carbs are not healthy for everybody, to allow more options. Anything that's going to impact the dietary guidelines that way is going to trickle down to the school lunches. I mean, it sickens me when my kid comes home and says, their lunch was pizza and muffins and low-fat milk. And I mean, that is not nutrition in anybody's book, but somehow that is a dietary guidelines approved lunch. So we absolutely need to flip the dietary guidelines to change them, because they are so influential in policy of what we can and can't feed our children and our elderly and our military and everywhere in between.
We talked a lot about food. I want to talk a little bit more about prescriptions and medication.
Yeah.
You mentioned statins for LDL and cholesterol. I'd love your thoughts on some of the other medications like blood pressure medication, aspirin. My mom's told that she should take aspirin every day. Do you have any thoughts on that?
My first thought on medicine is we just rely on medicine far too often. It's easy. It can be effective, but at what cost? So aspirin is the perfect example, right? Aspirin seems so simple, right? Aspirin comes with a real bleeding risk. It used to be that we kind of recommended aspirin for everybody. And then the science was showing, actually, it's more harm than good for the majority of the population. Something as simple as aspirin, right? So if that's the case for aspirin, well, what's the case? What are we talking about for statins or for GLP-1s or for so many other medications? We sort of lose this risk-benefit analysis because the assumption is often that the risk is very, very low, when in reality, it's a little bit higher than we think. And look, all you got to do is watch a football game on TV. And at the end of the football game, you're like, wow, I just saw 20 different medicines I need to ask my doctor about, because all these commercials that make you seem like, oh, these medicines are great. I got to talk to the doctor about it. And And it really has sort of tainted this risk-benefit analysis, where something as simple as aspirin, we've learned through research that actually it's riskier than we thought, and not everybody should be taking it.
So when do you know to push back against the physician that tells you take aspirin every day?
Oh God, isn't that so hard? As
It's
an
so
individual,
hard.
you're not trained, right? You don't know. You didn't go to medical school. And this is where social media is really sort of a mixed bag, because so many people are talking about it and raising red flags. But what credentials do they have? Where are they getting information from? It's the Wild West. There's no, and so it has to be this mix of physicians being open-minded and being open to questions and questioning their own advice. And those are the physicians you want to seek out. You don't want to seek out the physicians who just do cookbook medicine, but the ones who really want to learn about you as an individual and weigh the risk-benefit for you as an individual. And I hope we're getting more and more of those physicians. And as a patient, hopefully you have an opportunity to seek those physicians out.
Well, it's hard to discern who is that physician that you can trust that is going to look for the bigger picture.
Yeah.
What about semaglutides? There's a new one now, retatrutide.
Yep.
Every other month there's a new one.
Yeah. Well, look, I mean, these medications are being hailed as the weight loss miracle. And in a way, they are. I mean, they are more effective, safer and more effective than any weight loss drug we've had. And with the obesity crisis that we have, the timing is certainly necessary. But it's the same thing. It's relying on a medication to quote unquote solve the problem. Is that a long-term solution? Is that an economic solution? What about the side effects? And, we know now with real world evidence that, less than a third of the patients remain on the medication at a year. So what happened to all those thousands of dollars and that weight loss that, they gain the weight back and the money's gone, and it was a very expensive failed experiment. So we can't rely on the medications solely. We still have to realize that lifestyle interventions are absolutely crucial and a cornerstone of metabolic health, of weight loss, of type 2 diabetes. And the medications can still have a role, but we can't fall back on the medicines as the one and only solution.
Is there any research or evidence that the semaglutides can cause any damage? I mostly don't hear about that. I hear that it's expensive, that people gain the weight afterwards. And usually people's answer is, that's fine. Like, I just want to be skinny for the summer, and therefore I'll go on whatever semaglutide it is, and I'm willing to throw the money at it. I mean, people will throw a lot of money at vanity. You know that. And so, but the question is there an actual risk in getting on these semaglutides? Is there actual research that can hurt your metabolism or hurt your body long term?
Yeah, there are definitely concerning side effects. I mean, there's risk of pancreatitis, there's risk of stomach paralysis, there's risk of thyroid cancer. There's the risks are they click up. Now, is it a high risk? Are 50% of the people going to have a serious complication? No, it's a small percentage, but that really has to factor into what benefits am I going to get out of it? How long am I going to stay on it? And what else am I doing? I think that is so important because. And look, I guess, addressing it for vanity is one thing, but trying to treat your type 2 diabetes, to treat your severe obesity, to improve your metabolic health. I mean, those are the outcomes that we want. And if those aren't the long-term outcomes that we're getting, then what are we doing, right? And so we have to ask ourselves, what else can we do to help achieve those long-term outcomes?
Supplements have become a big conversation. What are your thoughts on creatine?
I have a funny story about creatine. So my son is a, teenager. He loves to work out and he's a wrestler and he's super strong. He asked me about creatine 2 years ago. And I said, you don't need creatine. You don't need supplements. Creatine can be risky. You don't want to do it. And then I started to learn about it. And I learned about the mental health benefits of creatine, not just the muscle benefits, but the mental health benefits of creatine. I'm taking creatine. My son's taking creatine. I'm a big fan of creatine.
Creatine for children?
Well, he's a teenager.
Okay.
He's a teenager, so I don't know about younger than that. But I'm actually a big fan of creatine now. I think looking at the research and what's been done, the mental health benefits, and of course the physical and muscular benefits with very little to no risk. Now, it's a supplement. Supplements aren't regulated as much. You want to make sure it's pure creatine. I don't want to, recommend any specific brands, but people need to do their research to make sure it is a reputable brand and that it's pretty much pure creatine. And still talk to their doctor before doing anything. But I'm a converter. I did a great podcast with Dr. Nick Fabiano talking about creatine and the mental health benefits of creatine, specifically for depression.
So not just muscle, but actual mental.
Yeah, specifically for depression. There's some impressive results. And we keep learning more and more about it.
Any risks in taking creatine?
Very little. There was a thought that it's harmful for your kidneys, but in reality, it can change a blood test for kidney, but not clear that it really hurts kidney function. Now, if somebody already has kidney disease, or if they have liver disease, or if they have other medical conditions, of course you have to be careful because it hasn't been studied in every single medical condition. But it's really pretty well tolerated.
Any other supplements that you love?
I'm a big fan of magnesium. I think a lot of our food is kind of deficient in magnesium, the way we're growing food. And if you're low carb, you may lose more magnesium. So I think I'm a big fan of magnesium.
What do you think about everybody's been told that they should take vitamin D?
Yeah. I think we need to get more sun. That's what we need. We need more sunlight to help our bodies create natural vitamin D. Now, for those who can't do that or don't want to do that, then if I think a vitamin D supplement is pretty reasonable. Checking your blood level, of course, and making sure it's in the right range and working with your provider.
Do you think we need a lot of supplements, doctor, or can we get most of what we need through food?
We should be getting most through food. Now, if we are eating a nutrient-dense diet, which for me is going to include a lot of animal products, high protein, not high protein. When I say high protein, people think lots of different things, but certainly higher than what is currently recommended from a protein standpoint. And then eat an omnivore type diet, you're going to get just about everything you need. Yeah.
Even though the food is deficient in nutrients because of the way it grows, all of that.
And that's why I recommend magnesium for a lot of my patients. Not necessarily everybody, but for a lot of them, because I think our food is going to be, tend to be deficient in magnesium. But yeah, like most of the supplements we should be able to get with food. Now, if you're eating a very restrictive diet, if you're eating a vegan diet, of course, you're going to need supplements. Now people are eating carnivore diets, and we're learning whether or not they're going to need supplements or not. But if you're on sort of a wide end of the spectrum, maybe you are going to need supplements to make up for something. But, a good whole foods omnivore diet should give you most of what you need.
What do you eat?
What do I eat? I eat a whole foods omnivore diet. I'll start the day either not eating breakfast or having, 3 eggs with some smoked salmon and cheese and a bell pepper, right? That's a common breakfast for me. Lunch is usually Cobb salad or leftover veggies and salmon. And then dinner is steak, ground beef, chicken, salmon with, broccoli, cauliflower, bell peppers, avocado.
Sugar, wine, alcohol, any of that? Coffee?
So coffee. Coffee for sure. Black coffee. Couldn't live without it. Well, maybe I could, but I wouldn't want to. And then sugar, no. So
no sugar.
Well, certainly no added sugar. I'll have some dark chocolate here and there, but yeah, certainly no added sugar. What else did you ask? Wine, alcohol on occasion. Yeah, on occasion, some wine, but definitely not the sugary mixed drinks or those types of things, right? You asked about coffee. What is Starbucks? Is Starbucks a coffee store or is it basically a sugar store? I see Starbucks as a sugar store. I still go to Starbucks often and get my black coffee, but I'm in the minority getting the black coffee. Mm. Everybody else is getting the sugar drink. So got to be really careful about, what we're drinking and how much sugar that's again, the no-brainer, right? Mm. The no-brainer, if you want to improve your health, what do you get rid of? You get rid of the real sugary Starbucks drinks, or not to pick on Starbucks because so many other companies are doing it, but that's the no-brainer. But that we can't, that's part of the human nature about whether you want to call it addiction or the draw or the joy of it and the emotion of it, right? It's hard to get rid of despite being so obvious.
Mm. It's so hard to take on a new lifestyle right away, right? For people who are used to eating all of the things that are at any food court that we find. What are small steps that you think we should start with just right away? Just give us a piece of advice of how to get started so that we can keep going.
Yeah. And of course, it depends on where someone's starting with, but the simple things like don't drink your calories, right? Like we got in this concept of fruit juice being healthy. How did that happen? Take all the fiber away from it, concentrate the sugar, and it's still healthy? I don't understand how that became a thing. I mean, that's just exactly the opposite. So don't drink your calories.
Not even the cold pressed juices and all of those?
Yeah, even those that they're masquerading as health, but they're really just they're simple carbohydrates that your body's going to absorb and is going to adversely affect your metabolism. So
Wow.
yeah, get rid of those things. You don't need them. Eat your food. Eat your whole foods. Get your nutrients from your foods. Don't drink it. I think that's a very simple thing that could help a lot of people. And bring back protein. Absolutely bring back protein. Any natural source of protein. I think we need more of. I think we're becoming protein deficient. And I saw there've been a number of articles about this recently with, of course, now processed food companies trying to jump on the protein craze and add protein to their processed foods, right? That's not the protein I'm talking about. I'm talking about whole food, real protein sources, focusing on that.
So no protein shakes, protein powder, protein shakes, protein bars.
I'm a mixed on those because some people struggle to eat adequate amounts of protein. So if you really are trying to eat whole foods protein and not getting enough of it, then a good quality protein shake, okay, or a good quality protein bar, okay. But defining quality is certainly an issue, but really defaulting back to trying to get it all from food as much as possible.
Interesting. Well, thank you for coming on. It was great, and I will stop drinking my calories.
That was my pleasure. Thanks for having me on and for having these important discussions. I mean, so much of what we're learning, we have to sort of unlearn and relearn. So having these discussions is a great starting point. So thank you.
Thank you, doctor.